You can see from that, it's at the top of the page, it denotes brain trainers. Well, this is a form of therapy that you can actually self-train yourself, self-train your brain to alleviate, as it says at the bottom, attention deficit disorder. You're hearing a lot more about that now with the kids. Ann Tracy's going to talk about Prozac and how they're wanting to put a lot of the kids on these. And I've had some personal experiences lately where the teachers and counselors did recommend not only the Prozac but the Ritalin. And there's far-reaching detriments with those, and Ann Tracy will probably talk about that. So with the attention deficit disorder, there's also learning disabilities that can be alleviated. And this basically is a means of balancing the various parts of the brain. Traditionally, biofeedback has always entailed the placement of electrode sensors on certain sites, more or less on muscles. Eeg Neurofeedback, I like to call it because it's more accurate that way, is basically electrodes on the scalp, and it begins to measure brain waves like an EEG or electroencephalogram. Those were traditionally used for brain injuries to identify specific brain waves and brainwave patterns. Biofeedback has now advanced to the point where we put electrodes on the scalp, reading specific parts of the brain, and then we can attenuate our training to specific outcomes. For example, learning disabilities. I think perhaps sometimes we've heard of children that are really good in math, but they don't do so well in spelling. That's different parts of the brain, different sides of the brain, the linear and the intuitive. And neurofeedback can address the imbalances thereof. Left-right brain is also pretty common occurrence. And also the front and the rear parts of the brain are different. They all have certain functions. We're now stepping into areas such as chronic pain and migraines. Biofeedback was traditionally very effective on those. Chronic fatigue syndrome presents another medical condition that basically is generally addressed with physical intervention, or the doctors say it's all in your head. Well, it may be in your head, literally. It's actually inside your skull and your brain. We're also going into areas of peak performance. A lot of the inventors here, they've received their insight through higher states of awareness, and a lot of athletes can appreciate that. When you hear an athlete say they did well because they were in the zone, in the groove, this does have a certain bearing and direct implications from the brainwave patterns that they've exhibited, and those would come about with repetitious training as well as a mental attitude and confidence. Premenstrual syndrome for the ladies is now receiving some more attention through neurofeedback. The symptoms are pretty well addressed. There's been some remarkable changes. I like talking on this subject because I really believe in it, and I've seen the results. My specialty in this is, my pet interest of area is the immune system. I've worked in the cancer clinics in Mexico with doing various therapies, and I've even gone out on home care assistance working with a naturopath, and it always seems to get back to the patient's mental attitude and emotions. And that's something that I found out neurofeedback can really address, and address strongly. Go ahead. There's two primary aspects to biofeedback and neurofeedback these days. Alpha theta training is, now that you've got accustomed to hearing frequencies and hertz, is your slower brain waves. Alpha is 8 to 12 hertz, and theta is 4 to 7, respectively. And that's generally aimed at achieving a state of relaxation, or the theta waves producing creativity. I think that's what a lot of these inventors really experience, is alpha and theta brainwave creativity. Also, alpha theta was traditionally used by Dr. Peniston. He was one of the pioneers working with Vietnam veterans, and associated with alcoholism and drug abuse as well. I do have some data on that, and it seems to work awfully well on alcoholism, and post-traumatic stress syndrome is still with us. Some Vietnam vets are still suffering from that, whether it be from drinking alcohol or just still upset and nightmares. The other modality is sensory motor rhythm. It's usually called SMR, and that's your higher brainwave training. It includes the beta waves. 12 to 15 is your lower SMR training range, with your 15 to 18 hertz in your upper range for your beta training. And that's generally, this is what works really well with the kids on ADD. It also improves mental functioning. It trains their brain to move a little quicker. And that's what the teachers are seeing in the schools, is daydreaming kids, lack of focus on the kids, and then they write a note to the counselor, go to the counselor, and then the counselor makes a recommendation to a doctor who automatically fills out a prescription for Ritalin. Okay? That also works with epilepsy. You can see in the middle, original work with neurofeedback, EEG neurofeedback, began with basically epilepsy. And you can see how it's branched out to closed head injuries, migraine headaches, stroke, stroke recovery. You have chronic pain, which was traditionally an ideal modality for biofeedback's use. Also, I thought it was interesting to note that it does have a large effect on diabetes. That's a glucose uptake dysfunction, and you're seeing more and more diabetes and hypoglycemia. And that does have direct correlations to the brain, certain parts of the brain. Also depression. You look around today, you will see and know of people who aren't quite up to snuff. Over on the right-hand side, it began to address ADD, attention deficit disorders, along with specific learning disabilities, dyslexia, Tourette syndrome, unbecoming behavior, conduct disorder, bruxism with teeth grinding, especially at night, sleepwalking, and bedwetting. This has all been able to help the children, and I think that it has been really remarkable, the results that Siegfried Othmer and Susan Othmer have gotten through their research with their clients. Okay, you want to go? My background includes certification in hypnosis as a hypnotherapist, and also I ended up at the other end as a colonic therapist. And I think it's interesting to note that neurofeedback did indeed help irritable bowel syndrome. Well, all the nerves are connected from the brain to the bowels, and there's quite an impact on the state of mind in the elimination process and the colon and small intestines in general. Now here we can see the effect of stress. It begins upstairs with the hypothalamus, and this is a form, it's a depiction of mind modulation, how it really comes down from our mind, from our brain, and it affects the autonomic nervous system, unconscious activities. And it goes on to, I think, is really important, because I think this is going to have a real basis in cancer and immune dysregulation, autoimmune dysfunction, is the endocrine system. And also on the right, the immune system. And they're all tied together. Okay? And here's another example of the nervous system attaching from the brain to various sections of the brain to various organs of the body via neurocircuits, the nerves of the spine, etc. Kind of like the knee bone connected to the shin bone. Everything's connected, and we have to be really aware of what our thoughts are, our brainwave states are, because it will indeed affect physiology and our organ function. Okay. Another example, start with the pineal gland, pituitary gland in the brain. Affects the adrenals, the kidneys, the ovaries and the testes for the males. It also affects hormones through the endocrine system. And I think that's going to be found to be a basis as well, hormone imbalances. And I think the man with the dark field microscopy out front can show you some examples of hormone imbalances on the microscope. I've had some experience with dark field microscopes and live cell analysis, and what I would really like to do is see a before and after session of the blood work involved prior to a neurofeedback session and then afterwards, because there's a lot that you can see about the immune components, the phagocytes, the macrophage activities, and this is typically going to be a cancer patient right here. This is out of Carl Simonton's book, Getting Well Again, and this is basically a trail of how psychological stress causes depression and despair, leans on the limbic system, affecting the hypothalamus and pituitary, going on down to affect the immune system, the endocrine system. The immune system gets suppressed through suppressed T cells. On the endocrine system, the increase in abnormal cells equals cancerous growth. I was really interested in the immune system and cancer. It seemed like it always got back to the mental and emotional states, and you could never really put your finger on it. And cancer patients aren't generally really willing to talk and be therapized. So, and with neurofeedback, it's more or less an automatic. They're in control. They're taking responsibility for their condition. Conversely, here's a model of recovery, a psychological intervention, and that can happen with neurofeedback. The patient expresses hope and anticipation. The limbic system increases its hypothalamic activity, pituitary activity, boosting the immune system, restoring hormonal balance in the endocrine system. Decrease in abnormal cells, and the cancer regresses. One thing that always was curious to me was spontaneous remissions. You hear the story of a man goes to the doctor, and the doctor tells him he's got cancer and he better be in to receive the therapy, chemotherapy, within 2 weeks. He says, no, I'm not. I got a vacation to go on, goes to the Bahamas, comes back 3 weeks later, gets tested again, and there's no cancer. You know, what's up with that? That's part of the amazing part of the brain and the mind and the attitude. Well, what we're seeing today, especially in the kids, the gangs, the violence, criminal behavior, is that we're seeing certain brainwave patterns. A lot of work has been done with children, especially a friend of mine related a home for murdering kids, kids that have committed murder, also bullies, aggressive behavior. They've experienced neurofeedback training, and they've just gone the opposite way. I don't know if your local newspaper carried this article in its Sunday Parade magazine, but it's How to Calm a Child. Now we're seeing neurofeedback, EEG neurofeedback, coming mainstream. The medical establishment is so willing to accept it as a therapeutic modality that they can recommend and perform. And this gives an account of the bullying behavior, the violence, the murdering, how neurofeedback had changed that behavior. Susan Othmer and Siegfried Othmer are mentioned in this article. They have a practitioners network across the nation, and I don't know if they would be in your hometown or not, but they're getting pretty widespread. Can I get it?
Sir,
Conditions that are favorably impacted with EEG neurofeedback. There's ADD, with or without hyperactivity, childhood sleep disorders, childhood depression, anxiety and panic attacks, chronic headache, migraines, and tension headaches. Specific learning disabilities, if they're good at math, good at spelling, but not so much in language. there's an imbalance in the parts of the brain, and we can measure those through 24 points of contact where we place the electrode. So you can basically identify the points that are out of balance. It also measures amplitude, electrical activity, as well as the filter bands of the various frequencies. Brain injury, I think, is really important. A lot of us go through life having had a concussion or a bump on the head. Even some of us have experienced damage to the brain through birth trauma when the doctor extracts us from the mother's womb. Upwards of 150 pounds of pressure put on our soft skulls with the forceps. Now they're seeing quite a bit of that, more and more, and they're able to attribute that to a birth trauma. Also, I'm interested in multiple chemical sensitivities. I recently am winding down my duties with family-run pest control, and the community is now experiencing quite a bit of reluctance to go the old pesticides, so I had formulated alternative natural pest control products and programs, and we're getting a lot of multiple chemical sensitive people, which a lot of times they're also food reactors or universal reactors. They react to even the foods they eat, and they have to reduce and diminish the number of foods that they eat. And unless something's done about that, their foods are diminished and they can get real sicker and sicker. Autoimmune dysfunction, such as arthritis, diabetes, lupus, and also I've become more interested in multiple sclerosis lately. These are where the body actually attacks itself. And so there's something in the hardwiring of the brain that is affecting the, giving incorrect signals to the immune system, the immune components to have it attack itself. Along with food reactors, each particle of food is saw as a foreign invader, and they will have hyper-alert immune systems, immune components. They're on red alert. If you look at the psychology, I've been noticing that the psychology of the person is mimicked in the immune system. If they're depressed mentally, emotionally, then they're going to have a depressed immune system. There have been a few studies that came out that for men that have lost a mate to cancer, within 18 months, they, in fact, are found to have cancer themselves. And that's pretty close. 85% of men do that. And I was a personal witness to one. And it was kind of strange how it really got right on down to 18 months to the day, just about. And that's because of their depressed mental state, and it's really picked up in the immune system. There have been tests and studies proving that a cancer cell goes undetected without the surveillance necessary of a healthy immune system. Goes floating right on by a macrophage, doesn't even see it. Very strange. Also, I've noticed too lately hypervigilant psychology, a hypervigilant, nervous, anxious type of personality is also mimicked in the immune system with symptoms of sinusitis and high eosinophil counts. I saw that. I've been around 2 or 3 people like that, and you can almost take that to the bank. Alzheimer's, I think there is some good work to be done with neurofeedback, since it is really dealing more precisely with the brain rather than neurodermal, muscular dermal sensor readings. I think that you can really begin to look at the hardwiring of Alzheimer's. And I think that there can be some reparative electrical activity restored in spite of the physical actual loss of brain volume. Okay. Here's a neat article in Megabrain that I picked up, Self-Regulation of the Immune System. And what they have found is, through the studies and tests, that they have been able to now prove the connection between the brain and the mental state and the immune system. That the application of neurofeedback techniques that reorganize and reorient brain electrical activity can, in all probability, be utilized to modulate positively the immune system. As we saw before in the previous slides that we have connections to the brain directly to the endocrine system and the immune system. A lot of times the natural killer cell activity, which is mediated by the T cells, is significantly decreased in stressed out individuals. Those are your cancer surveillance and cancer attackers. When a cell goes abnormal, we depend on the killer T cells to gobble them up. A lot of the benefits with neurofeedback have been a clarity and a perception of reality with greater acquisition and control over fluctuations in moods. And it's not to be found in a pill. Okay? There are claims by the experts that neurofeedback may eventually allow humanity to transcend our present limited consciousness as we experience true liberation from automatic stress responses, addiction, chronic pain, anxiety, depression, and a variety of other emotional and physical limitations. I'm more of an encourager and a supporter of this modality rather than a marketer. I see a lot of problems and I automatically think, well, I wonder if neurofeedback could help that. And a lot of them have already been outlined. A lot of the problems we see around town and around the nation can be addressed with neurofeedback. One of the problems is, I don't know if one of the, here just for your own info is a larger picture of the brainwave ranges and frequencies. The bottom, starting at the bottom, is deep sleep, delta, and the theta is typified with deeply relaxed, inwardly focused. These are meditative states that transcendental meditation was found to contain, and especially from Harvard's Herbert Benson in coining the term relaxation response. So you're starting to see quite a bit more meditation out of the general populace in the United States as well. From theta goes on up to alpha, very relaxed passive attention, and then you see the beta SMR training, 12 to 15 hertz, and it's basically relaxed, comfortable with external attention. Mid-beta, active external attention. You're getting up to 20 hertz there. High beta is 18 to 35. It says there high correlation with anxiety when that is the dominant brainwave, when it's about 30-40% of all the 4 or 5 brainwaves. Also, it's been associated with peak performances on up to high beta and gamma. And you can see a lot of crystal methamphetamine users quite anxious, quite anxiety ridden. And I believe that upon ingestion of the crystal meth, they're bumping their brain waves up way high. Would that make sense? Mm-hmm. And I think that it's pretty well taken as a given in these therapeutic circles that alcoholics want to slow their brain waves down. Okay, next. And here's just a picture of certain brain waves. At the top, pretty excited. It's all pretty well close together. That's beta. That's probably working from 12 to 18 hertz. And as you relax and go down to alpha, the gaps between the spikes become wider and wider. Down to theta, just kind of floating along. These are sleep spindles, the next one, the 4th one down. And those are unusual because one of my instructors, Barry Sturman, was the first to actually begin to use EEG neurofeedback as diagnostics. And what he did find was your average house cat, he's got these electrodes sticking out of this cat's brain. So he's measuring these brain waves. Well, he takes them to a gopher hole. And as the cat, we've seen cats sit there and watch the gopher, wait for the gopher to come out. And they're just sitting there patiently, and we just think they're really cool, just sitting there doing their job. Well, what he found was that they go into a rest mode like a printer or a copy machine, And what he found was sleep spindles of a low brainwave frequency. And that was kind of unusual because then we'll see the cat attack the gopher, and he's on red alert and he gets them. And then you see the deep sleep delta waves get wider and wider. It's just kind of meandering along. Okay. So the idea here is to actually reduce what we had seen as detrimental physiology, detrimental habits from detrimental brain waves, from our attitudes, negativity, doubt, fear. Those all produce pretty high brain waves, panic, anxiety. And what we're dealing with here is stress cortisols. These are excreted, the hypothalamus leans on the adrenals, and we're going to a fight or flight. Well, certain biochemicals are released. Those are stress cortisols, and they cause stress diseases. Adrenocorticoid steroid hormones also depress the thymus gland, which is responsible for producing T cells. So with too much cortisol, which is another hormone, you can have hormone imbalances, and you can have predispositions and high risk for many diseases. I run across all kinds of interesting information, you know, as the cosmos, the good Lord would have it. I ran across this one article about the stress cortisols. There's a lot of literature written up about it, but you, the public, the lay researcher, would have to really start digging in, and you'd have to know what you were going for. And so, fortunately, there's been individuals that have done quite a bit of this work for us. Some studies have compared a normal subject's cortisol levels with a person that had just probably experienced some surgery, infection, or burns in this case, and measured those and compared those and found elevated cortisol levels. And that can oftentimes spell the difference between a quick recovery or a slow or non-recovery. Stress diseases, cancer is one of them. High endogenous cortisol has been measured in cancer patients. And a lot of times we see a cancer patient that we think has always been jovial and pretty happy. And we go, if this is a stress disease or if it's an anger disease, how did this person actually get that? Well, us human beings in our society, we're really good at hiding our emotions. And I think that those begin to play an actual role when they're out of our sight. Regardless, I think the stress cortisol begins to take its toll day and night. My friend in Dallas, she was a victim of a closed head injury. She got hit in the side of the head. And she was forgetting to eat. She was depressed. She was confused. She was indecisive. She wasn't working. And eventually, with Dr. Walker's help in Dallas, she was able to go back to work. All those symptoms were relieved with alpha theta and a mixture of alpha theta and beta training. And that's pretty remarkable. That I keyed in on that was that there was actual physical damage to the brain, and through electrical stimulation and balancing of certain parts of the damaged area, the brain was able to shift over responsibility and duties of that damage and also provide enough electrical activity, enough electrical energy to that for the cells, the tissue cells, to repair itself. Neurons, no, I don't think so, but then my main motto is never rule anything out. But I do know that the experts are claiming certain conditions, maybe even Alzheimer's, could benefit from this, with the potential for the brain to go global and begin to shift responsibility over to other sections that are basically similar and equipped for that duty. And here's just another list of certain conditions. Let's see. Nothing really new there. Why don't you go ahead and flip me the next one. So the results obtained can be with, for example, hyperactivity, ADD, learning disabilities, conduct disorder. elimination of hyperactivity, and the teachers always love this improved attention span. Well, I'm all for this. I'm not for Ritalin. Improved socialization. A lot of antisocial behavior comes out of ADD and ADHD children. Improved cognitive performance and motor skills. You can actually, and you could probably draw a line to the increased performance of an athlete, increased coordination, increased motor function. With epilepsy, this is how Siegfried Othmer and Susan Othmer got involved and came into this field and then founded the company, was their son had epileptic seizures. And Dr. Othmer had previously worked for Hughes Aircraft. And when he saw that biofeedback at that point in time had basically eliminated his son's seizures, he left Hughes Aircraft and began working in neurofeedback along with his wife and formed EEG Spectrum, the company. And they are supposed to have, according to my friend who has worked with a variety of equipment, the most sophisticated computerized equipment out. It's the most effective, and I really like it. I've had a chance to try it as well, and it's quite an experience. It's a lot of fun experience. Epilepsy usually occurs 40% in the nighttime, and 50% of the time epilepsy follows a head injury. And the benefits resulting from neurofeedback can be reduced incidence of seizure and the severity as well. Normalization of sleep. Okay, with the head injuries, like my friend, she thought she had chronic fatigue. She recovered her energy levels. The mood swings, the depression was alleviated. Improved attention span. I mean, when you forget to eat, how focused can we be? A lot of times head injuries, the dizziness, nausea, chronic headaches, and the nausea-causing vomiting is a result of the concussion. Also her memory, of course, forgetting to eat, improved memory function. And she's a great gal now. Here's the efficacy of biofeedback training with epilepsy. About a 61% reduction in seizure incidence. Hyperactivity, 75% of children responded to SMR training, done during 88 and 79. Learning disabilities, 6 of 6 children, done by Joel Lubar, exhibited significant increase in academic performance. 24 out of 24 children benefited. Okay.
Sir, can I ask you
Sure, go ahead and ask any questions you'd like.
a question about epilepsy? What happens with the, I'm just trying to get an idea of EEG. It seems to me it's the frequency of the brain.
Right.
Okay? And I was wondering what couple questions, what epilepsy, what is it, what frequency, what's going on with epilepsy?
Okay.
First one.
Roughly, I believe that you could find it to be true that there's erratic ups and downs in brainwave activity. If sleep at 40% of the time occurs while they're sleeping, these seizures, then you're beginning to get into lower brainwave frequencies. And I think you're going to see some just imbalances when one part of the brain, when we reach alpha, theta, sleep states, brainwave states, certain areas aren't up to snuff. And
Is that why they just fall out and just kind of collapse and start, like, they look like they're going right to sleep?
Right. You could probably, on an EEG, and this has probably been done, watch the dominant brainwave patterns. They'll go to alpha, and all of a sudden then that would, I would say, trigger certain biochemical activities, electrical malfunctions, maybe short circuits in the brain.
Shuts down the air system.
Right.
And the other question is level. Now, this EEG works when you're asleep. What's the relationship of somebody that has you would determine a little bit messed up, not a normal system, and are they dysnormal while they're sleeping? As when they're awake, is their brain activity the same as they're awake in their as when they're sleeping with an abnormal person?
What it's doing is creating flexibility. It's creating a greater range of balance. Okay, so it's taking the high highs and the low lows and even them out. It's also evening out certain bilocation electrode positions, start to balance left and right. If they're finding through the QEEG, where they do a brain mapping of the 24 sites, they're finding out high electrical potentials, imbalances, front and back, left to right. Okay, so it's just balancing basically all the electrical activities of each part of the brain, fore and aft, left to right. So I think you're going to see a lot. It's going to take the high highs and low lows out of it.
I have a question on like a sleep levels of theta of like a level. I think they call it level 2 sleep and level 4 sleep. I was wondering. I had recently learned that people are taking melatonin to go to sleep, but that doesn't get you into the deep REM sleep that you need for rest. A lot of people millions of people are taking this melatonin to sleep. It does put you out, but it never allows your brain to go into that restful, deep sleep.
Right, the REM sleep.
And that's what I was wondering. They have some like new material out there. It's like a precursor for human growth factor, human growth hormone, and that just puts you out to Never Land. And that stuff seems to be pretty effective, and I think it helps your body in other ways too.
Right.
If you could comment on the sleep levels and the frequency of the brain and how that correlates to sleeping and awake, I'd appreciate if you just touch on that.
Yeah, I have some graphs of the brain waves of, say, an alcoholic and a seemingly normal person. And you'll just see gross differences in the brainwave activity. A lot of times this is precursed during the daytime with some type of emotional experience or an event. And I think we all take our day to sleep with us. And I think if we don't react in the daytime, ideally or most excellently, then we're going to take that to sleep with us. We're going to have sleep onset problems, and then we may not be able to get quite to REM sleep for that full rest. Okay? And I think a lot of us are either doing caffeine or drinking to get that, to inhibit our ability to get that restful sleep, along with the tour of duty during the day as well. It just forms patterns. I think a lot of the daytime activities begin to form patterns of responses. You could almost see it in the contents of your dreams too, you know. So I think the REM state in dreaming is really necessary for to empty the trash of the day, to assimilate our experiences and decide what is a good memory to hold, what is useful, what will tend towards our survival, and trash the insignificant so we don't fill up our hard drive. I hope that answers your question. These are really experimental areas, the brain and the mind. The brain still is the most little understood organ that we have. It's so strange and so obscure and mysterious. It's hard to draw the line where the mind ends and the brain begins. But we can look at the brain as our CPU, our hard drive, our biocomputer. It basically follows functions. But remember again, our mind is not necessarily contained in the cranium or in the gray matter.
The other question I had is what organic health substances and vitamins and so forth would you recommend to help with this normalizing your EEG to have it in a more normal state?
Okay, that's an interesting question because I've talked a bit with the people at EEG Spectrum, and I said, well, you know, can't we just do nutrients to solve some of these problems? And their response was, well, yeah, you could, but you may not receive full efficacy because what if that particular symptom and substance was tied to a part of the brain that was out of balance and not functioning optimally, it would not be assimilated. And I think that's where you get the variance in various degrees of efficacy. Some people really respond to melatonin, St. John's wort, How come the other people don't? So I think that's where you're getting variances. Even in modern medical establishment therapies, you always have this variance. Well, it worked on the last person. I was close enough to a man who shared a cancer vaccine with me a few years ago. And it worked really well on some cancers. It seemingly didn't work on the same cancers in other individuals. Well, you could tell right off that they weren't obviously the same people, but they were pretty similar with a few differences. And they're saying with MS that they're angry, very inflexible. So you're starting to see psychology mimicked in physical symptomology, and especially like with cancer, the immune system. Deep down held anger. Most psychologists, psychotherapists would attribute that to some emotional, mental misgivings.
So are you saying this is basically like weightlifting, but it's just all electric, it's just exercise of your mind? No, you're not moving any mass, you're not doing no substance, it's all electric neuron weight, it's like exercise of neurons or something.
Use it or you lose it. And this is the benefit, this is the great thing about the training is, it's just like an athlete. He can train, or even a bodybuilder, he can train to get bigger biceps, or if he has to work on his thighs, his legs, or his back. It's really specific because you can move the electrodes, and then you can constantly, through the therapies, sessions, monitor your progress, and it will change. And then they will have to move the electrodes to other parts to promote the balance. They're always looking for a balance, and they have some parameters of electrical potential plus brainwave dominance in a given task. You don't want to be going to sleep when you're supposed to be driving a car. It's appropriateness. And that's what they're trying to do is autonomic training, autogenic training for the individual. What I experienced when I did some training, I think I did high beta because I was in this big hotel up in LA, and I was kind of confused a bit. I'd walk out the elevator and I didn't know which way to go. I'd walk into one elevator and back out the other. This was all kind of confusing. So when they asked me which training range I wanted to do, I said, well, let's straighten me out a little bit and get me a little more focused. So I did the beta training. And what was really interesting was the programs that they have set up on video, and the kids just love these things. All they do is they sit there, and all they're told is basically make Pac-Man go. And they set the parameters for if they need to slow them down to alpha or raise them up into beta. They set the parameters for that, and they get rewarded, either with a little beep or visual cues that reward them. It's a game, and it's really neat. And one thing I did notice was during the training, I played with it. There was a mural scene behind it. I was training for higher brainwave activity in beta, and so I kind of daydreamed and pretended to go into the little forest. Okay? Well, here goes the purple alpha box, and here goes, it's going crazy, and I'm not getting rewarded. Okay, and here goes the beta. It goes small. Okay, then I start to play with it oppositely, where I pretend to be really intensely focused. And all of a sudden, here the purple alpha box goes down, and the yellow beta goes up, and I hit the range, and I start getting beeps. Sound rewards, visual rewards, and also they have a tactile reward that gives you a nice little buzz on your tummy when you get rewards. So I think these are beginning to form memories of what that state's like. So when you come up across an event, a situation out in the daytime, you remember back to the way you're supposed to respond. We go back and we say, okay, I can do this. And you remember the resting heart rate. Say if you wanted to slow down, you can slow down. It's self-regulating, self-generating and self-regulating.
And if you never take the training, you'll never know where you're at. Is that what you're saying? You'll never know what to be on that focus. You won't know ever where you're at.
Well, it's a good user-friendly way of quickly, expeditiously moving to a certain brainwave state. Otherwise, you could do visualization-type meditations and calming exercises, but you'd never really know exactly where you were. I mean, and it would probably take time unless you had a guru that was really taking you through it, that was really experienced at seeing you hit those certain brainwave levels.
Is the software you're referring to the same that's advertised in Tools for Exploration?
No. I had experience as well with a lot of the mind machines. In fact, early in my career, I had several brain machines. Those are entrainment devices that provide stimuli. Basically, it's more of a passive experience than basically an involved participation and awareness of training to a certain level. It's more passive, and they're good for relaxation. If you want to play the tapes, I always thought it would enhance the subliminals or even self-hypnosis tapes to make sure that you were in that state. You know, so the brain machines actually act as an entrainment device, where neurofeedback actually is much more interactive.
All right.
Okay.
I've used neuroacoustical approach, ABR tapes, for brain entrainment, cross-lateral stimulation, and then
Right.
coupled with cranioelectrical, and 80% of the time in 6 weeks can reverse the, let's say, the addictive mindset
Right.
in many cases. But the biofeedback, I guess the other question I had was how long does it typically take for training with some of the program that you're recommending here?
I'd say on the average, depending on severity and symptoms, 20 to 40 sessions. That's usually done at 30 to 40 minutes each session, and a lot of times that would go anywhere from 2 to 3 times a week. Okay, so it will get into a few months. Oftentimes, you know.
In that context, for example, in working with hundreds of people using entrainment tapes, just pure sound, certain frequencies, within a matter of 1 or 2 sessions in many cases can release deep trauma and
Right.
make some dramatic differences and changes very quickly in comparison to trying to do a
Do you
long-term.
intervene? Do you intervene at all with guidance of you?
Working with youth?
No.
I'm sorry?
Do you provide any intervention guidance, visualization, or do you have a script that you go with them on?
No, it depends. I'm a
Yeah.
licensed clinical counselor
Right.
and so forth. So,
Sometimes you do, sometimes you don't.
right,
Yeah.
and then depending upon the situation, I've used light and sound.
Right.
With 80% of alcoholics and children of alcoholics have the hypercortex arousal state. And
Right.
so in some cases where we've either used the nutrients, ionic minerals, in some cases prescription for, say, 50 milligrams of dilantin,
Right.
which will it'll even off the brain waves, bring it down, and then you can get in and do the releases of whatever is oftentimes trapped emotionally.
Right, and you're finding a lot of times calcium supplements are beneficial.
Calcium?
Calcium supplements.
Yeah, in fact, I don't know sometimes what works. We just do a lot in
Right.
terms of nutrients rather than trying to figure it all out, and that oftentimes does the case. We've
Right.
had children as young as 4 years old, traumatized at 2 with molestation within
Right.
1 session. First, let's say, hadn't cried in 2 years, all of a sudden started to be able to
Yeah, a
breathe.
lot of times those happen automatically, and with alpha theta you get slower, and those are basically the brain waves ranges that you're dealing with, that you're taking them to through entrainment.
Yeah.
A lot of times that stuff happens automatically. My friend had a religious experience while in an alpha theta session, and that's what basically, with or without guidance, the Vietnam veteran studies were showing that it would almost happen automatically. So we got this innate intelligence that's helping us along. It's pushing us to recover and heal our wounds. And I don't know what part that plays with the cosmic intelligence, but I think Providence really does want us to advance. And if we're not advancing, I think under the right conditions, these wounds can be brought up, the scab can be broke off, and the healing take place.
Are you saying as a general rule, we want to bring our brainwaves lower down to the theta level?
It depends on where you start out. If you're hyper, then I'd slow down a bit. If you're kind of spacey, kind of dreamy, lack of focus, then you want to go up.
Go up.
And that'll change, too, through the sessions, and they do change. One session may be alpha theta, one to slow down, and the next sessions might be beta. It depends on, see, the EEG reads it and records the session each time, so the technician reviews the last session and makes adjustments to the parameters in the next session, discusses it with the doctor, and so it can go, you know, back and forth. This is a really neat thing. This is a little girl named Lauren after 20 sessions. You about getting ready? Okay. I thought this was really neat because you want to flip the other one on and then maybe go back to that, the next one. I think these are some pictures. And you talk about creativity, and as a psychologist, you can begin to see improvements in not only artistic ability, but I think the symbolism expressed in her pictures has vastly improved along with her artistic abilities. At first, and this was 3 months, 3 months at 40 sessions. And so in 3 months, this little gal goes from stick figures to some pretty decent drawings. And psychologists would always want you to look at the symbolism in the placement of certain family members and other objects, as well as what kind of facial expressions. And if you look at the bottom there, they all got smiles on, so Lauren's happy. You know, why don't you go back to the previous, and we'll just look at what she was doing before and after. And I think this is kind of a typical example of a lot of them. This is what I've heard, and this is in the literature and that I saw. Before, had no tolerance, zero frustration level, zero attention span, very distracted, easily overwhelmed in unfamiliar situations, real panicky, unable to organize thoughts, unable to organize toys and belongings, inability to follow lines or paths with a finger, a real motor function problem. She didn't play well with others. Motor delays in fine and gross motor. Unhappy most of the time. Okay. Why don't you lower that? We'll see. Yeah, there you go. And then after, she became age appropriate in frustration and attention span, basically 80% of the time. Still overwhelmed in unfamiliar situations, but adapts more easily, usually after 5-10 minutes. Great organization of thoughts, a big ability to argue her case like an experienced lawyer. Pretty neat. Still unable to organize toys and things, possibly conveniently. She can do mazes, follow board games, plays well with others now, buckles a seatbelt, dresses self, buttons zippers, writes name. Occasional tantrums with far less frequency and far less severity, cheerful and happy most of the time. And I think that's about what I've seen as typical in the before and afters. Real interesting stuff, and I just really, I enjoyed sharing this with you because a lot of this stuff we just don't know about. I thank you for being here, and I thank you for your attention.